Hi, I'm Senator Ben Cardin of Maryland, and I want to welcome you to our nation's capital. I also want to thank all of you for coming here to join in the fight against juvenile arthritis. Juvenile arthritis affects more than 300,000 children in America, and treatment for this debilitating disease can cost families more than $50,000 a year. As a member of Congress for more than 24 years, access to affordable, quality health care has been one of my top priorities. We have made progress in fighting juvenile arthritis, but more needs to be done. We need more doctors who understand this disease. We need more researchers looking for cures. And we need more support for children who are living with juvenile arthritis. One important success that I was pleased to be part of was the passage of the Affordable Care Act, which prohibits health insurance companies from denying health coverage to children with pre-existing conditions such as juvenile arthritis. By coming to Washington as part of the Juvenile Arthritis Conference, you are raising the awareness of this crippling disease and advocating on behalf of the families that couldn't join you today. Thank you for standing up against juvenile arthritis and giving hope to thousands of children suffering from this disease. My thoughts and prayers are with you.
Hi, I'm Congressman Tom Petri from Wisconsin, and I'd like to welcome you to our nation's capital and to the 2011 Juvenile Arthritis Conference. Juvenile arthritis is a disease that has somehow managed to slip our national consciousness despite its immense impact on over 300,000 of our nation's children. I'm here to let you all know that I'm not okay with that, and I'm lending my support to the fight against juvenile arthritis. Every day, more and more children are diagnosed with juvenile arthritis, so every day we must strengthen our efforts in the struggle against it. As we learn more and more about this disease, we are constantly learning about new forms of treatment and effective ways of dealing with pain. I'm confident that our efforts will continue to make a profound difference in the lives of families dealing with juvenile arthritis, and that is why we are all here today. We have come together not only to fight this disease, but to learn and grow with one another, to learn from a number of diverse experiences in dealing with juvenile arthritis from around the country. I hope you enjoy your time here at the Juvenile Arthritis Conference, and I look forward to working with all of you in our fight against juvenile arthritis.
Aloha. Welcome to our nation's capital for the Juvenile Arthritis Conference of 2011. Your dedication and commitment is critical in fighting this debilitating disease. So much has already been accomplished thanks to you. The research and medical innovation resulting from your efforts to date have bettered the lives of many. But there is more work to do. With just 150 practicing pediatric rheumatologists to care for more than 300,000 children affected by juvenile arthritis in the United States, and escalating ambulatory and medical costs, we need more doctors, more researchers, and more support for our keiki, our children. I hope that during your time at this conference, you learn more about the important and inspiring research going on, and meet new friends and families to add to your support network. You are the most powerful advocates in spreading awareness, marshaling political support, and searching for a cure for juvenile arthritis. I am certain that your time here will be enjoyable and productive. And again, I send my best wishes and warmest aloha to all.
Hello and welcome to Washington, D.C. I hope you are all enjoying your time here and are looking forward to a great conference this week on such an important issue. I want to thank you all for joining the fight against juvenile arthritis. Your efforts here are working toward improving the lives of hundreds of thousands of children in the United States. I understand how the disease has impacted your lives and your families, and I too believe all efforts should be made to improve the future for our children affected by juvenile arthritis. Your presence shows an important stride in developing a strong undertaking and displays your individual efforts to improve the lives of others. So much has been accomplished in research and medication, but still a constant energy is needed to ensure the continuation and progress for the cause. I understand there is still a shortage of researchers, doctors, and information, and I believe with your help, more awareness can be spread about an issue rarely associated with children. This past March, my office had the pleasure of meeting with a sweet 6-year-old girl, Hannah, currently in remission of juvenile arthritis. While listening to her stories, it was hard to imagine such pain experienced by such a young child beginning at the age of 2. There should never be a time in a child's life where they are denied the opportunity of living without worry. Children with arthritis deserve a normal life, not limited by their conditions, and living with pain should never become a daily expectation, especially by children. The federal government must work to continue looking for ways to build upon the advances already made and find a cure for future generations. Thank you all for your dedication to a cure. I will continue to support the efforts in the fight against juvenile arthritis and hope you enjoy your time here this week in Washington, D.C.
Hello, I'm Congressman Michael Burgess. I represent the great state of Texas, and I'm pleased to welcome you to our nation's capital. As a doctor, I understand why juvenile arthritis is an important issue and how this disease impacts your lives as well as the lives of your families. I've seen the challenges that come from living with arthritis and the importance of helping fight this disease. The research and medication that has been developed has helped change the lives of many here today, and you continue to push further. I commend you, your families, and your colleagues. There are over 300,000 children suffering from juvenile arthritis. In my home state of Texas, more than 4,000 kids live with juvenile arthritis, and yet there are only 150 pediatric rheumatologists in the entire country. I understand we need more doctors, more researchers, and more support for our children in dealing with this disease. I hope that during your time at the Juvenile Arthritis Conference, you will learn new ways to cope with your arthritis, find out more about the important and inspiring research going on, and meet many friends and families to join you in your support. After all, each and every one of you is here not just to help yourselves, but to help your brothers and sisters, mothers and fathers, and everyone who is learning to deal with juvenile arthritis. Thank you for taking the time to listen. I am certain you will enjoy your time here in Washington, and I would like to extend a special welcome to the Texans who are here to learn more about how to cope with this disease.
I'd like to welcome you to our nation's capital and thank you all for being here today. It is wonderful to know that such a committed group is coming together to work on not just treating, but also preventing and raising public awareness about juvenile arthritis, an issue so close to all of our hearts. As a school nurse and a proud member of the Congressional Arthritis Caucus, I know the impact of arthritis on our families and on our communities. And thanks to your incredible effort and tireless enthusiasms, my colleagues in Congress are well aware of your commitment. In the past few years, we have made great strides toward improving care and treatment of juvenile arthritis. This includes the passage of the Affordable Care Act, the new health care law that ensures our children with juvenile arthritis have access to insurance without pre-existing condition exclusions and without lifetime and annual coverage limits. Moreover, increased funding for critical research at the National Institutes of Health has supported initiatives like the Childhood Arthritis and Rheumatology Research Alliance. Although it is only in its beginning stages, this research alliance is presently collecting data from the largest group of children with juvenile rheumatic diseases nationwide. The scale of this project is unique, and I'm hopeful that the data, which will be available to pediatric rheumatologists throughout the United States, will lead to a better understanding of juvenile arthritis and the development of new evidence-based treatments. I will continue to fight for NIH funding for programs like this, because increasing support for medical research is not only an economic driver, it's our surest way toward ensuring treatments are accessible for all who need them, and keeps us focused on the importance of working towards a cure. I'm proud that we have accomplished so much together over the years, but we know more needs to be done. We need more healthcare providers, more researchers, and more support for our children dealing with juvenile arthritis. And in these tight fiscal times, your vocal support of these programs and goals is especially needed. So I hope that you use your time here in Washington, D.C. to make new connections, learn more about arthritis, and become an even stronger advocate in the search for a cure for juvenile arthritis. Again, welcome to Washington, D.C. I look forward to working with you to continue fighting against juvenile arthritis. Thank you.
I'm delighted to welcome you to our nation's capital, Washington, D.C. And I'm delighted to welcome you to this conference, the National Conference on Juvenile Arthritis. This is an important conference because it deals with a disease that is rampant in America. Over 300,000 children suffer from juvenile arthritis. It is painful, it is difficult, and it costs our economy in terms of medical costs, lost weight work, lost effort, and lost time over $128 billion a year. I've been very close to the Juvenile Arthritis Foundation for a long time. I myself have arthritis and I understand the pain that it causes an adult, but for a juvenile it can be terribly difficult. I hope all of you enjoy this conference. I hope you learn better how to deal and cope with the effects of juvenile arthritis. I hope also it gives you a chance to get involved in this organization. It's fundraising. It's hope for research and improvement and one day a cure for juvenile arthritis. Your being here today is a testimony to your commitment to help children with arthritis do better, get well, and live a happier and healthy and more comfortable life. I share that dream and that ambition with you, and I'm glad you came to Washington to learn, and I hope when you leave, you've learned enough to help cope with the pain, but importantly help us to raise the money necessary to eventually find a cure for this debilitating disease for our children. God bless you and thank you for participating.
Hello and welcome to the National Juvenile Arthritis Conference 2011. I want to thank all of you for coming out today to discuss this critical issue, especially those of you who made the trip out from my home state of Washington. As you all know, juvenile arthritis affects the lives of so many families across America. We've come a long way in our efforts to combat this disease, but we have a lot farther to go. We need more researchers working on juvenile arthritis, more doctors who understand it, and more support for the children and families who suffer from it, which is exactly why conferences like this are so important. By gathering together, meeting each other, and learning more about the important and inspiring research going on, you are helping to form the core of a strong advocacy effort. By joining together along with the Arthritis Foundation, you can help spread the word about this disease, and you can help raise awareness and gather support for the resources we need to fight it. So thank you once again for coming out here to our nation's capital. I appreciate you making me a part of your program today, and you can count on me to be a strong partner in the fight against juvenile arthritis. Enjoy the rest of the conference.
Welcome and thanks for coming to Washington, D.C. to continue the fight against juvenile arthritis. You are here because this disease impacts your lives as well as the lives of your families, but I know you also represent so many, way too many other young people that could not join you today. I want you to know that I'm your ready and willing partner in the fight to end juvenile arthritis. We've already seen encouraging advancements, but we'll push further. I continue to work with my colleagues to urge Congress to make a long-term sustained investment in medical research through the National Institutes of Health. Since initiating this leadership effort 4 years ago, we've seen a renewed commitment in federal funding for medical research. I believe that the National Institutes of Health represent our greatest hope for finding cures and treatments for chronic diseases and conditions like juvenile arthritis. I firmly believe that we must commit every available resource to exploring innovative new treatments and procedures that have the potential to enhance the quality of care and improve the lives of many here today. I hope that during your time at the conference, you make new friends, learn new things, and become a strong advocate in the search for a cure. Thank you.
I'd like to welcome you to our nation's capital to join the fight against juvenile arthritis. Over 300,000 children in the United States suffer from juvenile arthritis. It's important to me to make sure we're doing all we can to help fight it. Through your combined efforts, the research and medication we have today have changed the lives of countless individuals. We need more doctors, more researchers, more affordable care for our children dealing with juvenile arthritis. I hope that during your time at the Juvenile Arthritis Conference, you will gain valuable insight, meet many friends and families, and become a strong advocate in search of a cure for juvenile arthritis. I'm certain you will enjoy your time here in Washington, D.C., and I'll continue to support the fight against juvenile arthritis.
Hi, I'm Senator Mike Crapo, and welcome to the National Juvenile Arthritis Conference. Thank you for your ongoing commitment to the fight against juvenile arthritis. I commend you for taking the time to come together and share your experiences and knowledge this week. Unfortunately, this disease continues to have an immense effect on many lives and families. I understand how difficult it is for parents, siblings, and other family members and friends to watch loved ones suffer from juvenile arthritis. Entire families endure the disease together. While each day is a struggle, there is hope. This conference will inspire ideas, develop and strengthen partnerships, broaden support, and increase awareness of some of the inspiring research and methods to cope with juvenile arthritis. Innovative research and new medications have changed the lives of many here today. By joining forces to combat this disease, we will continue to make great strides in finding a cure. Together, we can strengthen the fight for our children and make a lasting difference. As we celebrate the progress already made in this fight, let us use this opportunity to press forward with a renewed sense of determination, support, and hope for our loved ones and everyone who suffers from this disease. Thank you again for your dedication to overcoming this disease and supporting others in the fight against juvenile arthritis. You are an inspiration to all.
Hi, I'm Sherrod Brown, United States Senator from the great state of Ohio. Thank you all for attending this year's Juvenile Arthritis Conference. Welcome to Washington. Special welcome to the Ohio families who are here today from Cincinnati and Loveland and Harrison and Westerville and Hudson and my hometown of Mansfield. Thank you all for your activism and your advocacy on one of the most important issues in children's health care. All of you know the statistics and the numbers and how the disease affects a child's life as he or she grows into adulthood. But even more important are the stories behind the statistics. That's why today's conference is so important. Advocacy for juvenile arthritis has come a long way and accomplished a great deal. But we know there's much more to do. We know that increased research and availability of medication can change the way we treat the disease and can change lives. We know that we need more doctors, more researchers focused on pediatric rheumatology to support the more than 300,000 children living in this country with juvenile arthritis. And we know the effect that staggering costs of medical expenses and lost earnings and reduced productivity, we know the effect that has on our nation and for your families. So as you meet with your senators and your members of Congress, I encourage you to tell your personal stories. Explain how cutting-edge research can inspire new hope and can inspire confidence for a child dealing with arthritis. Explain how your advocacy matters, not just for you, but for siblings and parents, for friends and neighbors, all of whom are fighting juvenile arthritis. And explain how our nation's future depends on how we care for our children and how we find cures today to secure a brighter future for tomorrow. Thank you again, all of you, for attending this year's conference. Thank you for sharing your stories in our nation's capital. I look forward to working with all of you, especially Ohio families here today, in our fight against juvenile arthritis. Thank you very much.